Do these companies have researchers that are adding to the information that will help us have these breakthroughs for learning more about propensity to disease and how to make medicine more personal? Do they have researchers? Are they adding to the scientific knowledge? Or are they, as the gentleman from Alabama seems to suggest, charlatans, and if they're all closed down, then so be it, that they don't really serve a useful purpose?
From the information we know, they're not doing their own research on the genetic profiles, but they're interpreting the studies that have been performed by others. They're not doing their own research on the genetic profiles, but they're interpreting the studies that have been performed by others.
A unique and significant part of our site is the research component. If you look at communities like Livestrong and Susan G. Komen, there is clearly a significant interest in individuals to contribute to disease research in a meaningful way. We give individuals that platform for contributing to research. In 2009, we launched our first disease community in Parkinson's disease. We enrolled over 2,000 individuals in the first 3 weeks alone. We have over 4,000 participants today. Last month, we published our first paper based on our community findings. Our goal is to continue to publish our findings, as well as to give our customers a sense of pride about the research they have helped create. Our research program is set up so that we are running hundreds of genome-wide association studies on a nightly basis. We have been able to replicate many of the major genetic findings and plan to publish more soon. We think that this database could be extremely helpful for quickly advancing genetic knowledge. Thank you.
They're not doing their own research on the genetic profiles, but they're interpreting the studies that have been performed by others.
So I think that Chairman Waxman is making a very good point. I don't think that the companies that are in question here would, if they disappeared tomorrow, would impact the scientific community and our desire to do research into genetics. I don't think I don't think that's really a discussion. This is all bogus. This is nothing more than the snake oil salesman revisited again in a high-tech community and in a high-tech way. It's very difficult to protect the public from itself and its desire to be healthy. So I think this committee is doing something that I think is very, very important, that we do impose significant, strenuous regulations on these laboratories and what they are doing and what they say they're doing.
We believe it is time that consumers are seen more as partners in health rather than subjects. Third, we passionately believe that individuals have the right to get access to their genetic information. 23andMe is committed to working with the FDA to make sure that individuals continue to have that right.
Are they going to understand it? What's going to be the emotional impact with that patient? Is it information they're going to be able to handle by themselves? Or it's really information that they need a physician or a genetic counselor to provide back to them? I would raise regarding companies going out of business, there's another side to this. The failure of FDA to regulate for many of these tests has created a disincentive for traditional manufacturers to get more involved in this area, and I think that stifles innovation as well. We need to consider it. Smart regulation can enable innovation.